In your practice, you do vitamin and mineral injections as well. And what scenarios are those recommended?
Well, certainly as somebody who I'm very concerned about their ability to absorb the vitamins orally, there are a lot of new preparations like sublingual, so they'll put it under the tongue, or drops. So sometimes I'll have success with that, and somehow they'll absorb it. But if I have somebody who's really deficient, particularly in a lot of the B vitamins or magnesium, I know that if I can give it to them intravenously, it's going to get into their system. And I'll do a series of them while we're trying to get them to absorb the oral preparation and get their gut healed, so that can be very helpful.
One of the other services you offer is detoxification. How often should people consider that or look into that?
You know, it's a great question, because the right answer is that we should be detoxing every day.
Okay.
Because we live in a very toxic environment. We're exposed to things, not just environmentally, but also through our food supply. Even if we think we're eating organic, even if we think we're doing the best we can, we are really sort of toxic.
Sure.
So the answer is that we should be thinking about detox every single day, what we're putting in our body, what supplements we're taking. But, in terms of a more formal type of detox program, I would say at least several times a year, it's important to embark in that kind of thing. And the type of detox program that I have is a very simple program. It's 14 days, which I think most people can do. And people are allowed to eat. They are allowed to sort of live while restricting some of the things that they shouldn't be having. So it's a very doable thing and can be very helpful. So I would say at least 2 or 3 times a year it might be very helpful for people.
And when you're talking about detox, there's a lot of over-the-counter products that people can get too. Is there a danger in that, and how much professional help should you have when you do a detox?
I think beyond the quality of the products, I'm not familiar with all of the ones that are on over-the-counter, but beyond that, a lot of people experience symptoms during the detox. If they're very toxic, they'll feel really bad on the detox program, and it may not be the supplement itself, it may just be what that person is going through. So I think it's very important to be under the care of somebody who's familiar with the detox program and what it means to the body. And so I have detox groups that I do, but I also have to individualize it, because I know that there's some people who will not be able to do it the way that everyone else is going to do it. So I think that's why it benefits to be under the care of somebody while you're going through that.
And in your experience, what are some of the more beneficial detox methods that you've seen?
I think that just in general, if you're doing some shakes that provide protein and some of the important herbs and supplements that can help the liver work better, those tend to be great detoxes. There's some pills that you can take if you don't want to do shakes and things like that. But definitely part of detox is really eliminating the things that are toxic to you. And a lot of that are the foods that we're eating. So even though gluten may not affect everybody, we do think that gluten affects a lot of people. So eliminating certain foods like gluten, dairy, at least part of my detox, we eliminate a lot of these foods that tend to be a little bit more allergenic to the person, a little bit more stimulating of their immune system. So any kind of detox can happen any day if people just avoid some of these foods that can be causing these problems.
We touched on some of the things that can happen if you try to do it yourself, a detox. There are a lot of over-the-counter pills that you can take for a liver detox. What are some of the symptoms or possible negative signs that people might experience when they try something like that?
Well, from what I've seen, the most common symptoms would be GI upset, decreased appetite, nausea, lightheadedness, severe fatigue. I've had people tell me that they couldn't get out of bed when they started the detox. So those are the most common things. I've seen joint pain also, fogginess, inability to concentrate, so difficulty sleeping. Yeah, many symptoms.